Hi, my name is Roshan Dan, and today I'll be presenting about the trends in deaths from firearm injury and drug overdose during the COVID-19 pandemic and its impact on organ donation in the US. Organ transplantation is a cure for people with irreversible loss of organ function. Organ donation relies on deceased donors, meaning any changes in the number and the cause of deaths in the general population will impact the transplantation process. Early in the pandemic, there was a sharp decline in life expectancy across all age groups in the US. While most of these increased deaths were related to COVID-19, increased hospitalizations from drug overdose were observed during the early pandemic. This intersects with 13% of adults reporting new or additional substance use during this time. Panchel et al. Concluded that the drug overdose death rate rose by a staggering 50% during the early pandemic. 2020 also saw a 64% increase in gun sales compared to 2019, with new gun buyers reporting higher suicidal ideation and mental health problems. Kegler et al. Found that in the early pandemic period, the firearm homicide rate rose by 34.6%, and firearm suicide rates also remained high. So, what impact do these changing death trends have on organ donation? A survey of US transplant centers found that organ donation decreased significantly during the first 3 months of the pandemic. Of transplants performed, donors who died of trauma decreased by 4.5%, while donors who died of substance abuse increased by 35%. However, this study overlapped with the initial lockdown period. This leads into my gaps in research, which are first, did the changes in death trends in organ donation noted in the initial pandemic period persist? And secondly, were any disparities associated with these changing trends? The goal of our study was to analyze data on firearm injury and substance abuse death to 1. Understand the impact of COVID-19 on past early 2020, 2. Assess whether changes in deaths in the general population were associated with changes in organ donation, and 3. Identify risk factors and disparities in the study population. My hypotheses were that the surge in substance abuse and firearm injury deaths in the early pandemic will persist and will be correlated with increased number of organ donors from these two causes. Additionally, that deaths will be higher in certain at-risk populations. This retrospective observational study was conducted during the period of 2014 to 2021 with a study population of US adults aged 18 to 75 years. We utilize the CDC Wonder database, which contains data on every cause of death recorded in the US, and we organized these deaths into two groups, firearm injury and substance abuse, and then collected demographic data regarding gender, race, and geographic location based on census division and urbanization level. Then, we use the UNOS database that has information on every organ donor and recipient in the US, and we organize this data into firearm or drug or overdose-induced deaths, and then into gender and racial groups. However, there was no socioeconomic data available for donors. RStudio and Excel were used for statistical analyses with significance defined as p-value less than 0.01. We analyzed, first, the crude rates of death per 100,000 population, second, changes in death trends using average annual percent change from joint point regression analysis, then, correlation between changes in death trends in the general population and changes in organ donation were calculated using the Spearman's rank correlation coefficient, and lastly, Poisson regression was used to determine statistical differences between demographic groups. Here are the results of our study. As shown in Figure 1a, between 2014 and 2021, the average annual percent increase in death was 16.4% from substance abuse and 3.4% from firearms. Notably, there was a significant increase in both firearm and substance abuse deaths in the general population during the pandemic period, starting in 2020 and further worsening in 2021. As shown in Figure 1b, a similar trend is depicted. There was a significant increase in organ donors from firearm injury and substance abuse death from 2020 to 2021, and an average annual percent increase in donors of 10.9% from substance abuse and 2.1% from firearms. Also, there was a positive correlation between the increase in deaths in the general population during the pandemic and the increase in organ donation from substance abuse and firearm death during this time. In Table 1, demographic characteristics of the study population revealed that the highest crude rates of death from firearm injury and substance abuse were noted in Black and Native Americans, that men were 6 times more likely to die from firearms than women and 1.5 times more likely to die from substance abuse than women, and that the highest rates of death were found in East, South, Central, and non-core non-metro regions, which are mainly in the rural South. Figure 2 shows trends in organ donation. From 2014 to 2021, the number of donors from substance abuse death increased by 362%, and donors from firearm injury increased 142%. As a percent of all causes of donor deaths, drug overdose increased from 7.9% in 2014 to 17.1% in 2021. Cause of donor death is important as it can impact the function of a donated organ. Substance abuse donors can have a greater risk of transmitting infections like hepatitis C and B, while firearm injury can cause organ dysfunction related to excessive blood loss. Table 2 shows the demographic characteristics of organ donors from 2014 to 2021, where males comprised 60% of all donors while there were 83% of firearm donors, whites comprised 67% of all donors while they were 80% of all substance abuse donors, and African Americans comprised 15% of all donors while they were 25% of all firearm donors. Can these increased deaths or associated risk factors be predicted? Figure 3 shows regional variations of various social determinants, which have been used to identify vulnerable populations in the past. What is interesting to note is that there is an overlap between substance abuse deaths in 2021, shown in Map A, and firearm deaths in 2021, shown in Map B. Further, these maps also overlap with poverty in Map C, lack of health insurance in Map D, and income inequality in Map F. The Community Resilience Estimate Index compiles many of the above risk factors and was designed to identify communities most at risk during natural disasters. As shown in Map E, we found that states with the highest percent population exposed to 3 or more risk factors also have higher substance abuse and firearm death rates. These results verified both of my hypotheses. What are the applications of this research? First, we hope to increase our understanding of the long-term effects of COVID-19 on the U.S. population. And second, we can evaluate how social determinants, mainly the Community Resilience Estimate, can be used to predict the impact of diverse national disasters, including excessive deaths from substance abuse and firearm injury. This can help create a more resilient society by guiding public policy to create targeted interventions for at-risk populations and guiding transplant centers to optimize the use of organs to expand the donor pool. Future research will involve further monitoring these trends using future CDC data and detailed socioeconomic data for donors. As of 2022, almost 17% of the US population has reported a substance abuse disorder. There is a high chance that either you or someone you know has been impacted by substance abuse in some way. This is why it remains critical that we understand the impact of the pandemic on at-risk populations and substance abuse trends. To summarize, this novel study found the impact of COVID-19 pandemic on rising substance abuse and firearm-related deaths persisted to 2021, correlated this increase with increases in organ donation from these two causes, and identified societal risk factors which can be used to design targeted initiatives. My name is Roshan Dan, and I thank you for listening.